Good evening. My name is Sushma. I am studying second year MD. How may I help you? I am here for general checkup. May I know your name and age? I am Nikita, 25 years old. Okay, I will start examining your nose, mouth and neck. By palpating for sinus tenderness, press on the frontal sinuses by avoiding pressure on the eyes from under bony brows. Press on the maxillary sinuses. Then, test for obstruction by pressing on each side of the nose by asking the patient to breathe in on both the sides. Then, ask the patient to tilt her neck back for examining her nose with otoscope using reusable specula. Gently insert the specula into her nasal septum through vestibule and find any deformities throughout the nasal cavity. With the help of good lighting, put the tongue blade into mouth and inspect the oral mucosa color and ulcers. Also inspect the teeth and their positions. Inspect the color and architecture of hard palate as the patient says ah or yawn. Check the mucosa behind the cheeks also. Check the shape of gingival margins and pointed interdental papillae and labial frenulum and labial mucosa. Here my patient's gingiva is partly brown in color. In addition, I am going to use a dentist instrument known as bent arm throat illuminator light, which is used for lightening oral cavity and pharyngeal area. With the help of this, inspect the tongue, color, papillae and symmetry. Watch the papillae on the dorsal surface, which is rough in structure. And then in addition, I am going to use a dentist instrument known as a dentist mirror, which is used to check the cavities or other infections at the back of teeth. Grasp the tip of the tongue gently and pull it out, and then check the symmetry of the tongue by palpating it evenly, and check the sides of the tongue side by side and up and down. Then look for ulcers and red nodules. At last, dispose the glosses properly. Palpate the occipital nodes, occipital tonsillar lymph nodes, submandibular lymph nodes, submental lymph nodes, and then occipital nodes, posterior cervical nodes, following superficial cervical nodes. Then note the size, shape and position of the thyroid gland by standing behind the patient. Then palpate the anterior superficial and deep chains and supraclavicular nodes located anterior superficial to the sternomastoid node. Ask the patient to extend her neck slightly backwards and sip some water and swallow. Observe for upward movement of the thyroid gland, noting its contour and symmetry. Then By standing behind the patient, place your fingers on her neck, sides, or cricoid cartilage. Ask patient to sip water and then swallow it. Observe the thyroid isthmus rising under my fingers. Then, if thyroid looks large, put the stethoscope to detect a bruit sound similar to the cardiac murmur sound.